Have you been feeling tired all the time, gaining weight around your belly, or waking up with high blood sugar, even though you didn't eat anything wrong the night before? Most people think these are just signs of aging or stress, but they're not. They're the early signs of something far more dangerous, and far more common than you think. It's called insulin resistance, and it could be the silent reason why your blood sugar is going up, your energy is going down, and your doctor is starting to mention terms like prediabetes, or even type 2 diabetes. But here's the thing. Insulin resistance doesn't just lead to diabetes. It leads to inflammation, weight gain, high cholesterol, high blood pressure, and even cognitive decline. And it starts years before you're officially diagnosed. Most people walk around with it for a decade, without even knowing. By the time they realize something's wrong, they're already on metformin or struggling to bring their fasting blood sugar back to normal range. And it doesn't have to be that way. In this video, I'll show you what insulin resistance really is, what causes it, how it silently damages your body, and most importantly, how to reverse it naturally before it becomes full-blown type 2 diabetes. Because yes, you can reverse it, and the sooner you act, the easier it is. But let's start from the beginning. What is insulin resistance? To understand it, we need to go inside your body, into your blood, your pancreas, and your cells. When you eat food, especially carbs, your blood sugar rises. In response, your pancreas releases insulin. Think of insulin as a key. Its job is to unlock your cells and push the sugar from your blood into your muscles and liver so your body can use it as energy. In a healthy person, this system works smoothly. Eat, release insulin, store sugar, done. But in someone with insulin resistance, the keys stop working. Your cells become resistant. They don't hear insulin anymore. So your pancreas starts yelling louder. It releases more insulin, hoping to force the sugar in. But the cells ignore it. They resist. Now your blood sugar stays high, and your insulin stays high, and your body starts to break down. This is how insulin resistance begins. And once that cycle starts, it's incredibly easy to fall deeper, unless you know exactly how to interrupt it. That's what we'll explore next. Because once you understand what causes insulin resistance, you'll know exactly how to stop it and reverse it naturally. Insulin resistance doesn't just happen overnight. It builds up silently, layer by layer, for years, and it's often triggered by things no one talks about. Let's break down the most common causes, and some that might surprise you. First, excess sugar and refined carbs. When you eat too many processed foods, sweetened drinks, white bread, pasta, and desserts, your blood sugar spikes over and over again. Each spike forces your body to release more insulin, and over time, your cells stop responding. But it's not just sugar. Too much eating, too often, even of healthy foods, can overload your system. If you're constantly snacking or eating 6 times a day, your insulin never gets a break. It stays elevated, and your cells become numb to it. Now add a lack of movement. Your muscles are like a sponge for blood sugar, but when you're sedentary, sitting at a desk, on the couch, or in the car, your muscles don't absorb that sugar. It stays in your bloodstream, and your body ramps up insulin again. Then there's poor sleep. Even a single night of bad sleep can make you insulin resistant the next day. Chronic insomnia, sleep apnea, or simply not getting enough deep sleep weakens your metabolism and raises blood sugar levels. And what about stress? When you're stressed, mentally, emotionally, or physically, your body releases cortisol, the stress hormone. Cortisol tells your liver to dump sugar into your bloodstream, preparing you for a fight-or-flight response. But if you're not actually fighting or running, that sugar just floats around and triggers more insulin. Chronic stress means chronically elevated cortisol, which means chronically elevated blood sugar and insulin. Now here's one you may not have heard: toxic exposure and inflammation. Pesticides, artificial ingredients, trans fats, seed oils, and even certain medications can inflame your cells, damage your gut microbiome, and make your body less responsive to insulin. This is why people who try to eat healthy but still consume industrial oils or packaged low-fat foods continue to struggle, because they're feeding the inflammation that drives insulin resistance. And of course, there's visceral fat, the dangerous fat that builds up around your organs. Unlike regular fat, visceral fat isn't just sitting there, it's active. It releases inflammatory signals that block insulin from working properly. This is why people with belly fat often have normal blood sugar for years, but sky-high insulin levels behind the scenes. Their bodies are fighting a losing battle, flooding their system with insulin just to maintain the illusion of balance. But eventually, it collapses. Your pancreas can't keep up, the insulin no longer works, and that's when blood sugar starts to rise. And you get the dreaded diagnosis, type 2 diabetes. The good news? Every single one of these causes is reversible. And in the next section, we'll go deeper into what insulin resistance looks like in the real world, the symptoms, the warning signs, and how to know if this silent condition is already affecting your life. Most people with insulin resistance don't know they have it. Why? Because the symptoms are silent, slow, and easy to ignore, until it's too late. But your body does warn you. You just have to know what to look for. Let's start with the most common signs. And then we'll talk about how insulin resistance turns into full-blown type 2 diabetes if nothing changes. First, there's fatigue. Not just being tired, but that constant, heavy exhaustion that doesn't go away after a good night's sleep. When your cells resist insulin, they also resist sugar. So even though there's fuel in your blood, your cells can't access it. You're running on empty. Next is belly fat, that stubborn fat around your waist that doesn't respond to diet or exercise. This is visceral fat, and it's both a symptom and a cause of insulin resistance. Then there are the sugar crashes. You eat something, maybe a sandwich, a bowl of cereal, or even fruit, and an hour later, you feel shaky, anxious, or ravenous again. This happens because insulin overreacts, pulls too much sugar out of your blood, and leaves you crashing. Another warning sign? Cravings, especially for sugar or carbs. Insulin resistance traps sugar in your bloodstream and starves your cells. Your brain interprets this as hunger, even if you just ate. You may also notice difficulty losing weight, frequent urination, or increased thirst, even if your blood sugar is normal. Remember, insulin resistance can be present even when your glucose is still in range. In fact, you can have perfect blood sugar, but sky-high insulin for years. Then there are more advanced signs, like dark patches of skin around your neck or underarms, called acanthosis nigricans, high blood pressure or high cholesterol, brain fog, irritability, or trouble focusing, and in women, irregular periods, PCOS, or fertility problems. All of these are connected to insulin resistance, and if left untreated, the damage spreads. Your pancreas, tired of producing insulin non-stop, starts to fail. Insulin levels drop, but not because you're healthier, because you're burning out. Now your blood sugar begins to rise. You cross the line into prediabetes, where fasting blood sugar is between 100 and 125 mg/dL, or your A1C is creeping above 5.7%. Still, doctors often say, "You're not diabetic yet." But the damage is already happening. Your arteries are inflamed. Your nerves are under attack. Your brain is less responsive. And your risk of heart disease, stroke, and Alzheimer's goes up dramatically. Eventually, if nothing changes, you're diagnosed with type 2 diabetes. At this point, many people are prescribed metformin or other medications. But the truth is, the root cause was never addressed. The insulin resistance that started years ago was ignored. But there's hope. You can still reverse it. You just have to give your body the right environment to heal. And in the next section, I'll show you exactly how, step by step, using natural strategies backed by science. Reversing insulin resistance doesn't require expensive medication or complicated routines. It requires changing the environment inside your body, so your cells become sensitive to insulin again. Let's go paso a paso. The first and most important step is to lower your insulin levels, not just your blood sugar, because most doctors focus only on glucose. But it's insulin, constantly elevated, that causes the real damage. To do that, you need to stop forcing your body to release insulin all day long. And that starts with meal timing. When you give your body longer breaks between meals, insulin has a chance to drop. This is why intermittent fasting is so effective. You don't need to starve yourself. Simply eating within an 8-hour window and fasting for 16 can dramatically improve insulin sensitivity in just a few weeks. Next is cutting out refined carbs and sugars. White bread, pasta, cereal, pastries, sugary drinks. They all spike your insulin, even if your blood sugar looks okay right after. Replace them with low glycemic, whole foods, vegetables, healthy fats like olive oil and avocado, protein-rich foods like eggs, fish, and grass-fed meats, and high-fiber foods like chia seeds, flax seeds, and leafy greens. These foods help stabilize blood sugar and keep insulin low. Now let's talk about movement. You don't need to run a marathon, but you do need to move daily. Walking after meals is one of the simplest and most powerful things you can do. Just 10-15 minutes of light walking helps your muscles absorb glucose without needing insulin. Strength training also works wonders. The more muscle you build, the more sugar your body can store safely, and the less insulin it needs. Sleep is another pillar. Aim for 7 to 9 hours of quality sleep every night. If you snore, wake up tired, or feel groggy during the day, look into sleep apnea, which is tightly linked to insulin resistance. And don't underestimate stress. Chronic stress, chronic cortisol, chronic blood sugar elevation. Incorporate daily relaxation practices like deep breathing, prayer, or nature walks to calm your nervous system. Now let's talk about supplements. There are several natural compounds that improve insulin sensitivity. Berberine works similarly to metformin but without the side effects. Magnesium, especially if you're deficient, which most people with insulin resistance are. Alpha-lipoic acid, powerful antioxidant that helps lower both blood sugar and insulin. Cinnamon extract, can reduce insulin spikes after meals. Chromium, helps regulate blood sugar metabolism. But remember, supplements are just that, supplements. They support a lifestyle change. They don't replace it. Finally, avoid the silent blockers. Industrial seed oils like canola, corn, and soybean oil, artificial sweeteners that trick your brain and disrupt your metabolism, low-fat processed foods that replace fat with sugar and starch. Eat real food. Rest your body between meals. Move daily, sleep deeply, and calm your stress. If you do these consistently, your body will begin to heal. Your insulin levels will drop. Your energy will rise. Your belly fat will shrink. And your blood sugar will return to normal, naturally. Now let's wrap this up with a message of hope and a powerful next step you can take today. If no one ever told you this before, let me be the one to say it. It's not your fault. You didn't fail. You weren't lazy. You weren't weak. You were never told the truth about insulin resistance, what it is, how it starts, and how early it needs to be addressed. Most people don't find out until it's too late, until they're holding a prescription for metformin, or sitting in a doctor's office being told they have type 2 diabetes. But that doesn't have to be your story, because now you know the truth. You know what insulin resistance is. You know how it builds silently, how it affects your energy, your weight, your cravings, your sleep. You know how it damages your body long before blood sugar even starts to rise. And most importantly, you know how to fight back. Right now, there are people just like you who are reversing insulin resistance naturally. without dangerous medications, without restrictive diets, and without giving up their life. They're using a different approach, a smarter one, a simpler one. If you want to discover what they're doing, what's actually working, it's waiting for you in the description below. Thousands are already changing their lives with it. You can be one of them, but only if you take the first step. And if this video gave you value, consider subscribing. We break down real science, real strategies, and real hope every single week. Leave a comment if this resonated with you. Let us know your biggest struggle or how insulin resistance has affected your life. Because you're not alone. And you're not powerless. You're just one decision away from turning it all around.